So yeah, it should be good. All right. You want to give me?
Hi, this is Jefferson, and I'm with BTC Manager. And today we have actually an exciting interview. Uh, so today we're going to be talking with Pradeep Goel of Solve.Care, and we'll be answering questions. He'll be answering questions that y'all have brought up over the last few days, and I just think it's just to start off with, just a little bit. I think it's fascinating what Solve.Care has been doing. It's really the first big application of blockchain to solve a very common problem that people have, which is access to medical care. Uh, and prior to Solve.Care, I can't think of really any blockchain technology that has been built to scale the way that Solve.Care has been. So it's really just from a technology perspective fascinating, and then on top of that, it's just trying to solve the issues, some very complex issues with healthcare. Uh, I mean, that's just a monumental challenge, and I can't think of anybody better than Pradeep to date that has really been trying to tackle it. So hey, Pradeep, just say hi to the folks, and then if you would, just tell us a little bit about what's going on.
Hello, Jefferson, and hello, everyone. It's an honor to be on your cast again, and excited to chat and provide an update. So thanks for having us.
So great. So what's new and exciting in the world of Solve.Care at the moment?
That's a loaded question. I think each day brings new opportunities and new progress. I'm very proud of the team and what we accomplish on a daily basis. And internal joke is that 1 year in Solve.Care will teach you more than you will learn in 10 years elsewhere and age you by 20 years. So it's a very hyper execution environment, and I'm very proud of the team. But in terms of what's new, there is a number of fronts. So I will try to formulate them into some kind of organization of thought. Uh, we announced recently our partnership with Uber, which complements our partnership with Lyft. And they are both incredibly valuable transportation services providers, albeit with different footprint. And our clients demanded that we support both. And I think we are very proud to say that to meet that client need and at their direct request, we are able to now support managed transportation benefits inside our platform for our clients to offer to their members or their patients or their employees, and they can set the parameters of use around when and how to use the transportation service and which transportation service will be used. And within certain parameters, now our clients basically can define a very broad and capable transportation solution. And this is appealing to insurers, it's appealing to employers, it's appealing to government agencies like Medicaid and Medicare and CHIP and others who are trying to deliver better access to care and better value for care for population groups that need help, whether it's the poor, the elderly, or the blind, or children, or pregnant women. So this has been always our mission, right? We want to improve healthcare, not just administer it effectively, which we do. Our platform delivers administrative efficiency than alternatives. But we are also really after not just administrative improvement, but also clinical care, quality and access improvement. And partnerships like Uber and Lyft really help us move that needle forward. So that's one big thing. The other big thing that we are doing, again, in alignment with our vision and our strategy and our published plans, is we are building a diabetes care coordination network, which is targeting adults with diabetes that are at high risk of heart attacks and/or other catastrophic complications. And our partnership with Boehringer Ingelheim to build such a network and launch it and then to scale it around the planet is something we're very excited about. We're working hard on it. And a good part of the team is currently working knee deep into the design and execution of the care network for diabetes. So clients and partners and healthcare and insurance stakeholders. And it's an epidemic. Diabetes is one of the most destructive ailments that humanity suffers from, and it's chronic. Once you get it, you stay with it, and it impacts your entire lifestyle, your finances, your relationships, your health, obviously, and premature death more often than not. So this is something that's worth doing, just from a pure and simple impact and cost of healthcare and impact on humanity. This is worth doing. So we're very proud to be doing that. We are also in the midst of really getting our Asia expansion strategy nailed down. In my 2 weeks on the road in Asia, we have really reached a point where our board is ready to review and sign off on a number of strategic steps that will position Solve.Care substantially in Asia. US is home ground. We're always going to be serving the US market. That's sort of table stakes. But we see Asia as a massive opportunity in terms of population centers and unmet and underserved needs of employees, patients, and citizens. So there is definitely an interest there, both from our side and from the client side. So you will hear more about that as once our board signs off on our plans. But it was very fruitful, very productive 10 days on the road. And I think the last update that I would have is that we have some very senior leaders joining the company in the near future that we'll be announcing. And that will allow us to build out the management team to truly be a global platform, to truly serve a global market, not just build the platform, but actually make sure it gets sold, deployed, and supported around the planet. So quite excited about all the fronts that we set for ourselves. And as you probably remember from my previous conversations with you, we tend to set very clear goals every quarter and then relentlessly focus on them. So I think we are on track for our Q3 goals, and we met our Q2 goals, and we have set some pretty aggressive Q4 goals, and I expect that we will meet them. Not easy, and certainly takes a lot of hard work and sometimes sweat and tears, but it is what we do. We plan, we execute, we repeat. So that's what Solve.Care is doing. And in summary, I think I'll say that what still surprises me when I go to conferences, and I don't go to many because they seem to be so repetitive and so uniform and not so different from each other. But when I do go to carefully chosen conferences, you still hear people talking about, well, there are so many potential use cases of blockchain in healthcare, and the art of the possibility is endless, and we can do so much. But when you really start looking at what is actually getting done, is so little. Is so much is just conversations about what is possible, what may be doable. There's a lot of proofs of concept running around. There's a lot of individual apps that are trying to prove that they add some value to the overall healthcare delivery ecosystem. But it seems like we are still spending way too much time talking. So I come back and I say to the team, we're doing the right thing, we're executing, we're solving big issues, and we're solving them for real scale and real value. We just need to keep executing, and that's our secret sauce. So long and short of it is, I feel like truly from an empirical and anecdotal evidence point of view, that Solve.Care just is way, way, way ahead of anybody else in terms of execution, both from a strategic execution and tactical execution. So we want to maintain that edge. We want to keep executing while we're happy to have the industry run around and have lots and lots of meetings and conversations.
So great stuff there. And yeah, one of the things I was just thinking about as you described all this, a couple of the things is really it's the global access to healthcare, right? Because at the moment, if you look at it, every country has their own strengths and weaknesses, right? Some countries actually have more affordable cancer care. Other countries have more affordable weight loss, even just weight loss, right? Weight loss programs. And I think this is an area where we can really solve the healthcare challenges globally, and especially if you add transportation into the mix, right? Which you started to with Uber. So I can easily see that over time, perhaps even transportation to other countries where they have specialists that can more readily treat some of the ailments that people have would then be available. And not only that, I mean, it would solve, uh, a lot of the other issues as well. Just touching on actually that one thing, weight loss and diet and that sort of thing. Uh, I one thing I've read, there was a few articles out there. Some of the doctors would say, for example, about stents, right? There's an idea that anytime somebody comes in with a cardiac problem, you fix it with a stent. And somebody did a study about the stents that are placed in people's hearts, and that it doesn't necessarily fixes the problem. It doesn't necessarily fix the problem. And actually, in many cases, it causes more problems than it fixes. And many of those doctors said uh, the patient would actually be better off just by going through a radical diet change, getting away from all the fried foods and processed foods to have a better outcome. So, with things like that, how do you see Solve.Care perhaps modernizing effective treatment delivery?
That's a great question. I think in many ways that's the essential missing ingredient in healthcare. And I will speak to my personal views here that for many years we have been treating the patient as a beneficiary, as a recipient of care. And in the insurance world, we even use the term beneficiary to describe you and I. We are beneficiaries of healthcare benefits. We're not human beings that actually have the ability to make decisions. But at the same time, we worry about and think about why the patient is not empowered and enabled, is not making good decisions for themselves. And it's just the way the industry has built its relationship with the patient, which is either physician shall tell you what you should or should do or not do with an absolutism, and if you shouldn't really have an opinion, or you don't even have the innate intelligence to have a second opinion about this. I, as an insurer, will tell you what care you need or don't need and where you get it from, and you don't have the ability to make good decisions for yourself. And this notion that you and I can make good decisions for ourselves, uh, it hasn't worked. And smart payers and smart care delivery organizations recognize that. They recognize that we can't just talk about engaging the patient while treating them as incapable of engaging, incapable of making good decisions. So long story short, our vision is to normalize the relationship and the decision making and the information sharing and information ownership and actionability of the patient doctor pair, or patient doctor insurer, if you will, using simpler terms, where we are at equal terms. One is not subservient to the other, and where we can coordinate as mature adults, not as me, John Doe, who cannot and will not and should not make any decisions for himself, and therefore does not need to know anything more than what he's told. And same is true for the patient, the insurer, and the doctor. So long story short is this: the whole purpose of using blockchain as a care coordination, as a benefit coordination fabric, is to allow these abnormalities of delivery and decision making to be identified. Even if I'm not, as a patient, capable of deciding whether the stent is good for me or not, I'm certainly capable of asking the question, what are the alternatives? Is this the only pathway, or do I have other options? And that function is the function of our care network, to give me a more holistic view of what I should be thinking about, what should I be asking my physician about, what I should be considering, what I should be doing, how I can engage the support of my friends and family and co-workers, and how my insurer can even be participating in helping me make good choices. So, we don't need to be at each other's throats to get good healthcare. We can collaborate. We do need to collaborate, and we need to make sure the patient is able to safely make good decisions or ask good questions. So if we can just start by empowering the patient to ask good questions at the right time, and we can lend them the support of other stakeholders in the network, we begin to fix a lot of these issues. This is not the only problem. Don't get me wrong. healthcare is more complex than just the ability to ask your providers second opinion or second other treatment pathways. But it certainly is an important element. So long story short, to your question, yes, the patient should have the ability to be informed of their choices. The payer can and the insurer can and should provide the patient with evidence-based, clinically sound information that the patient can use to make informed decisions. And yes, they should have quantitative and qualitative data to make good decisions on. And yes, the doctor should still practice medicine to the best interest, to my best interest. But I also need to be an engaged party in that care delivery, in that care consumption, and in that care outcomes. So we do need to bring that coordination fabric into play, and that's exactly the purpose in the case of diabetic care of our diabetes care network. And that is the same solution that we plan to apply to cancer and COPD and other disease conditions, and even to acute care and episodic care. So end of the day, we are trying to address exactly what you outlined as one example of where the patient-doctor insurance relationship could actually collaborate to achieve better results, and to do so at a better value, lower cost overall.
Awesome sauce. Well, along those same lines, access to care, right? There's actually between Blue Cross, Blue Shield, HMO plans, Veterans Administration, there's a lot of these different statistics that are actually used to try to discourage people from considering something like universal health care, right? Even global health care. And actually that delay in access to care causes a more negative health outcome up to and including, death. People waiting for a referral or people waiting for access to care, and that leads to some big problems. So how can blockchain improve patient access to these critical resources, even anywhere in the world?
Well, that's a great question. So from blockchain's perspective, the key element here is real-time synchronicity of status and need across all the participants of the chain. So if I'm using a blockchain as a patient and on the same chain I have access to certain services, which could be physician services or lab services or telemedicine services or transportation services, doesn't matter. I have a service provider on the chain, I am a service consumer, and I potentially have other stakeholders like my family, like my employer or my insurer or my government. They can coordinate the availability and utilization and payment of my care. So that fabric is the foundation on which you can deliver better access, better outcomes, lower costs. That's the foundation. Now, when you look at this fabric being used in different parts of the world, it looks different in terms of color. So you have this, you essentially have the same core fabric, but you will implement on it different flows. So in case of a fully managed care model where I am being managed from a care management perspective because I'm in a managed Medicaid program, for example, in effect, my insurance company is coordinating my benefits and my choices of physicians are limited. But the purpose of the fabric now is to make me aware of my choices, make me aware of my obligations, make me access those services efficiently, and for those to be paid efficiently as well, so that there is an incentive for the doctor to see me versus a commercially paying patient. So that's an example of the use of blockchain where really we're trying to align the availability of the care with the needs of the patient and rapid payment and timely and accurate payment. When you're talking about the same fabric being used, let's say, around managing a disease, where really the focus is on patient and his family members and coworkers and loved ones who care about him and coordinating this patient's care with a physician, we're not really talking about access as much as we're talking about the proper care regimen, the proper care protocol. But the fabric is still the same. It accomplishes the same foundational security, privacy, access, auditability, and actionability of the patient wallet. But what I'm doing is I'm using different set of cards. I'm using diabetes care cards versus generic access cards to healthcare. So my point in all this is we are designing a platform that fits the very specific relationships between patient, doctor, insurer, employer, government agency, and family members. And we can map the specific needs of the patient or the healthcare system or the delivery system to operate on this care fabric. So we really are not impeded at Solve.Care. We're not impeded by whether we are delivering a disease management network or a benefit management network or a service management network or all of the above. And in Asia, the needs are different than US, and we've already experienced that. The Asian insurers are selling supplemental insurance. They're not selling primary care insurance. Primary care insurance is largely subsidized by the government. So what they're selling is, next layer of insurance or the second or third layer of insurance above it. And their need to coordinate benefits between their supplemental insurance product and primary insurance product by the government is quite complex. You can end up with one instance of a doctor seeing a patient resulting in 3 bills being sent to 3 different organizations, each of them paying part of the bill, and then somehow they are all getting reconciled for the physician to receive their full payment. That's complex. It's even more complex in some cases in the US. So blockchain serves a different purpose there. It serves a benefit coordination fabric. The way we designed the platform is the care wallet and the care protocol in our platform can be adapted to any relationship model and any transaction process. So we haven't yet met a use case or a regulatory environment for healthcare where we said to ourselves, well, we can deliver value to this environment as the client wants. Because I think we have found that healthcare in its fundamental sense is pretty well predictable and definable. What we have to simply adjust is the relationships and the risk assumption and the cost assumption role, which can be different. But with those adjustments, you can pretty much go deliver a very compelling insurance benefit or employer benefit framework in US and build something very similar but different for Hong Kong and use the same platform to do it.
Amazing stuff there. So, along with that, actually, is I realize it's kind of a US centric thing to surprise people with massive hospital bills. But it could also happen to somebody that travels to the US from, say, Korea, right? So, if somebody ends up in the emergency room, because of a car accident or something, there's an idea that a doctor could happen to be out of network, even though he's affiliated with that hospital. I still don't understand that one. And then he's in the hospital room for 5 minutes, and that can trigger an $80,000 hospital bill. And it's that surprise medical billing that has actually bankrupted a lot of Americans. A lot of Americans, they're trying to prepare for retirement. They're putting money away in their 401k and IRA, and they end up with this $80,000 hospital bill, and that's the end of all their best laid plans. So how can Solve.Care help to address some of these issues, do you think?
Yeah, I mean, look, medical cost is an issue for all of us, all right? I mean, I can speak from personal experience. It's not even a function of your income levels or your asset level. I mean, these costs are staggering, and they are even more scary because you don't know what the cost is going to be. The care is essential, but the post-care billing is completely invisible. You don't know if you're going to get $1,000 bill or $100,000 bill. It just literally you don't know, and that's because there's no price transparency whatsoever. Now, to be fair to the clinical delivery model, you can price a service you haven't yet delivered, and healthcare unfolds. You don't know when you go into the physician doesn't know always or often what your care journey is going to look like. So it's not that they're selling you a finite service for which they already know the roadmap. They know the roadmap that they can start with, but by the time they finish treating you and by the time your body heals, you don't know what journey that's going to take. It's a very unique journey. And then you're paying for that journey, right? And how many people participate in that journey you end up paying for. And that's the problem for the insurance company too. They don't know when you enter the hospital, you go in there for a headache, you come out with a post MRI scan with a post cranial surgery or something. So nobody knows, can easily predict. However, that being said, it's no excuse for lack of price transparency on anything. Just because we can't predict everything doesn't mean we shouldn't make anything transparent. And in that regard, whether you're an insurance company paying the bill or you're a consumer paying the bill or employer paying the bill, there are many elements of this treatment that can and should be transparent. That's just a philosophical statement that I can make about healthcare in general, especially if I'm expected to pay for it out of pocket. So there are many solutions to this, and none of them are perfect. But the way we see blockchain being used for this is more effective coordination of benefits between the person being treated, the person taking responsibility for the payment, the person providing the care, and alternative means of care, and the ability to choose from both quality and cost perspective. That will absolutely require governmental intervention, especially in the US. Price transparency will not be achieved voluntarily. It will take a lot longer than if we have and should have government policy mandate that certain elements of healthcare delivery be transparent. They should be priced within a range, and that range be made public. And if we're going to be outside the range, that consent of the patient be sought before you're going to deliver that service to them. Because today, one of the big things that I struggle with, and all of us do, is that when we walk into a healthcare facility and we give consent to be treated, we are giving a blanket consent. You aren't asking for, you're not being asked to give consent for anything on the basis of what it's going to cost or whether you need it or whether this is the only option you have. Your example back to stents versus other alternatives. So you basically give a consent, and then you are in the hands of the system, and they can deliver the services and charge you or the employer or the insurer what they think is appropriate. So we do need a much more granular consent model. We need much more granular pricing and option discussion. And that, again, goes back to we need more care networks that are designed to give me, the patient, actionable information all along the journey. Don't treat me like a guinea pig. Don't treat me like I am incapable of making good decisions. I can make good decisions, but everything else, my finances, how to raise my kids, where to live, where to work, what to eat, and I should have the information to make decisions about my healthcare as well. But the thing here is that if I can't make those decisions because I'm ill or I am incapable, then my care circle should be able to. So we have this really innovative concept in the blockchain that we built called network within a network, or care circle within a care network, which allows me to engage people who are perhaps well equipped to spend the time and look at the options and evaluate various options, even if I'm too ill to do so. So the blockchain as a coordination fabric presents a lot of different options in terms of patient engagement, patient empowerment, patient actionability. And I really would like to accomplish one goal before all of this is over, at least in terms of this mission statement, and that is I want the patient to no longer be seen as a beneficiary. I don't want anybody to refer to me as a beneficiary. I want people to refer to me as a patient who was very actively involved in making good choices and doing the best he could have done under the circumstances to get well, either for me or for my son, for my dependents. So we need to use, a lot of the blockchain started off in the days of, if you look back 2 years ago, we were all talking about sovereignty of individual and freedom from the system. Some of it was, utopian thinking. Some of it was truly revolution looking for a cause. Some of it was very profound and is very profound. But what I'm looking for here is changing the patient's role in healthcare delivery system from a recipient to an engaged, informed, active consumer. And we have been talking about it for the last 25 years. I've been to numerous meetings and conferences and boardroom discussions and funding allocations where we talked about the patient empowerment, and literally we did nothing. So we did more of the same and then complained that the patient isn't getting any smarter. That is the goal we need to accomplish with blockchain, if nothing else, which is It's not about my medical records, frankly. It's not about my storing all my clinical data on my phone and giving you access to it. That's just a very small piece of it. The real piece of it is me being part of a healthcare decision-making process in a coordinated care model, because healthcare is always about coordination, and me being an active participant in the coordination of my care. I have to be part of it. If I'm not part of it, I'm never going to know when a good decision being made on my behalf or a bad decision, or when an alternative decision was available that nobody evaluated. And how will I ever trust it if I'm never informed of my choices? That's why we are so excited about care networks, diabetes, cancer, all those care networks we're designing, because it's all about you in the heart of the network. And even within the network, there's a care circle around you that you choose and you configure and you activate based on people you trust and you need the support and care from. And that's the network that you rely upon to make you an informed patient. I think that's revolutionary.
I agree. I mean, there's a lot of good stuff there, and I think it's important to think of uh, not a beneficiary, but a patient as a human being that's able to participate in the process. And I think it's that participatory process that is going to be so necessary as we have, these random diseases. One of the big fears that I actually have, and it's been raised by Michael Connolly, most famously in his books, some years back, but it's when you have a disease outbreak and how do you properly respond to it, right? And I would argue that today's model for healthcare is actually very inefficient at recognizing a disease outbreak and then being able to maintain that disease outbreak, prevent it, monitor it, whatever that is, right? Um, so, for example, there's actually now a rise in tick-related diseases in America, especially in the summertime, as people go outdoors. They enter in streams and forests and lakes and things like that, and they get a tick bite, which they may not even know they had a tick bite. Right? It's one of those. They get a bite, they rub their arm, and they keep walking away, and whatever else. Right? And then several days later, they can find out they have Lyme disease. So the most interesting thing about Lyme disease, the most fascinating thing I've come across that is that there is actually a vaccine for Lyme disease. But because of fear and paranoia, that vaccine got shelved. And Lyme disease is one of those multi-year diseases that can really affect the person's life, all from a tick bite, right? And the most astonishing thing is there's no effective monitoring program for where the ticks are, whether or not they have Lyme, or things like that. And so as a result, the medical community doesn't have the tools that it needs to be able to properly respond to Lyme disease outbreaks. So how can blockchain perhaps better provide a unified database, or what are your thoughts on that for how we can more effectively treat disease outbreaks?
Well, that's a great question. I need to think about that. I don't think I have an instant answer
Oh, no
uh,
problem.
because this is a public health issue and it requires coordination of public health authorities and care and pharma. And this is all about, we need to make sure that our population is aware of both the risks and the remedies of these kind of health events. And yeah, you're going to have scenarios where the patient is entirely unaware, and by the time the diagnosis occurs, we can look back and say this was entirely preventable, but it was not prevented because the patient didn't know they had to take action, or they didn't even know there was a need to take action. So what action to take, whether it's needed. So I think it's a very fundamental question, but in a larger sense, similar question exists for things like opioid abuse and so on, where we are looking at solutions around how to manage the consumption of uh, uh, the product and its impact on people, and engaging the care circle and ensuring that it is not being abused. And if it's already has been abused, how do we get the patient back on track by creating a care circle around the patient? But going back to your question, I think there is absolutely logical sense to capture data that is in the public interest, that is available and accessible to everyone. That in itself, I don't think blockchain adds much value, because you could do that in a variety of existing technologies in terms of publishing data. The key is getting the data in the hands of the person who needs it, in the hands of the person who is going to actually benefit from it. Otherwise, we can always point to data availability on the web. So I would say to you in reverse that solutions around blockchain that are actionable solutions that identify the need, that address the need, and that cause the need to be more effectively and efficiently coordinated between patient, doctor, family members, specialists. That's where I see the value in blockchain, and that's where I think this use case should be studied. But I do agree with you. This is an example of a tremendous amount of preventable human suffering, which we need to address, both by identifying when the remedy is needed and making the remedy available. That's what I would say to this particular scenario that you have laid out.
Fantastic. So, and the last question that I had actually relates to how new information comes out, right? And then being able to disseminate that for improving patient outcomes. For example, and I mean, there's the whole thing about research studies that I find fascinating, as there's a lot of stuff that's locked up by pharmaceutical companies because, for whatever reason, even though it's successful, they don't allow the treatment to go forward. But sometimes studies like this that I'm reading, that if you go on a plant-based diet, you're actually less likely to develop type 2 diabetes. And actually, I'm aware of some people that have significantly altered their diet, even though they were on, a lot of insulin every day. They changed their diet and they don't need insulin anymore.
Yes.
So, and I know a lot of that has to do with how the diabetes came forward and everything like that. But the thing I find interesting is that the doctors don't always recommend a diet evaluation, right? And especially in the case of diabetes, right? They're just so in the automatic method of prescribing insulin
Yeah.
and see in a week. So how can we better talk about lifestyle changes and diet changes and things like that to better treat some of the more common ailments?
Yeah, I think there is a lot of really interesting use cases we are looking at in the care wallet, in using the care circle around the patient to not just offer them better choices, but actually to see that those choices are adopted and used. I mean, we all know about diet, sleep, rest, stress, but the issue here is typically that life gets in the way. And what we are trying to do is to get the care coordination fabric around the patient, both from a enterprise support, insurer, employer, clinical support for me to do the right thing and to know what the right thing is, and also personal and social support in the form of care circles. So it's a circle within the circle that zeroes in on the need. I mean, the larger network is to serve access to care, quality of care, payment for care. But within that network, patient-centric network is really, really important. And that's where I think we have created, and we believe the right way to achieve is concentric circles of coordination, right? And each concentric circle is more intimate to me as a patient. I may not have a great intimate relationship with my insurer or with my government agency, public health agency, but I do have a very intimate relationship with my family members, with my parents, with my spouse, with my kids, with my coworkers, that when it comes to healthcare and lifestyle management, behavioral change, they are much more useful and impactful on me than, let's say, a brochure or an email or a TV ad or a banner or a billboard that my government can put up. So I think there are different levels of intimacy that drives different behavioral change, and In our vision of the blockchain, I'm essentially creating my private network in a larger network inside of a larger network, which serves different levels of need and delivers different levels of service, but at different levels of intimacy. And that's the vision behind managing clinical care with lifestyle changes, both on the same platform, by creating a tighter, more intimate circle around me that will help drive my behavior while I'm inside a care circle of a clinical organization, while I'm inside the benefit circle of an insurance company. Jefferson, I do have to
Yes, I
leave.
know you have to go. I really thank you so much for your time. It's been a fantastic interview. So thank you so much, Pradeep. So we were just talking with Pradeep Goel. He's the CEO of Solve.Care. Some amazing stuff there. We hope to have him back in a couple of months or so. If you have any questions, post it below the show link. And thank you very much.